it was a packed forum. Really, our intent for that forum was to provide a platform to hear the various signs. We made a presumption that because the Ministry of Health had already started, and in fact this was at the end of its consultative process, and it felt satisfied that they had done a consultative process, we did not want to turn our forum into that process. We wanted to be able to have the doctors and some other people speak on the actual plan. The first thing that we learned was because of the length of time, we were not able to have all of the questions fielded. So we took them in written form. We got 50 to 75 questions that would not have been answered in that night, and perhaps even more because more came in afterwards. So we have those. We put those questions to the Ministry of Health and the Chief Strategist about a month ago, I guess. We recently got a response a couple of days ago. They were able to answer 3 of the questions, and the rest, they say, are on their website. What we learned from that, Dianne, is that one of the reasons why it's so difficult to have a conversation about what we should do next is because people don't really understand. And also there are various levels of understanding. So we had some feedback that said this was great, I never got a chance to hear the sides. And there were other people who said, look, I already knew this stuff. I want to start here. Tell me about, unified systems. Some people didn't have a clue as to what a unified system was. So certainly what we determined at Age Concern at this point, because we have up to 5,000 members, we can't take a position because the positions are so varied depending on where you sit. Our feeling is that this education process has to take place. And until it can take place, it's difficult for the populace to give an informed decision about whether or not this is a good thing or a bad thing. From what I can understand, the National Health Plan proposals that are non-negotiable is that it will be a unified system. That is non-negotiable. That is a political decision. That has been done, okay? And I think there are many people who are grappling with, well, I want to have a say on whether or not that's the part that's not negotiable. But if indeed that it is a political decision, it's non-negotiable, it's a very bold political move, and now the responsible thing to do is to educate the populace around what it means, the language, the consequences, the examples, the benefits.